Okay. Outdoor Life, the Ultimate Survival Manual, Extreme Edition. And we're going to flip on to 09, which is Bandage a Wound. So what do they say about how to bandage a wound? Well, they open it up with this. It takes 72 hours for a skin to close and become airtight. For small cuts and scrapes, you just keep the area clean. For large cuts, you may need to do a bit more. And that's reasonable advice. Don't stitch it up. We've all seen our action heroes use needle and thread. Unless you have sterile sutures, a suture needle and a tool to hook through the skin, this option isn't happening. I totally disagree with that. Likewise, leave sterilizing and close it in with a hot knife blade to stars on a big screen. Absolutely. There might be a place for using hot cautery in very, very extreme situations, but the only people that should be doing that are people who actually have operating room experience, because you'll probably kill the patient, which, you might want to. In terms of stitching it up, now I don't agree with that. I think in a first aid situation you can use hand coverings, and you can dry dressing, you can do a lot of things rather than suture, and some of the advice I do like. But there is a place to actually suture if you're on your own hiking or kayaking or in the wilderness and you suffer a severe rip in the 6 to 7 inches long range. There's no way you can mobilize on that without it bleeding, and the blood loss could kill you, and you might have to get yourself out because you might not have a transponder or a cell phone that works. In those cases, the ability to actually suture the skin non-sterile would be a good idea. Remember, once you get help, they can help you out in terms of the infection. But if you can't get to help, you might die. So I don't necessarily agree with that. I think it's always a good idea to have basic first aid gear and basic first aid equipment. But I would consider learning how to suture. Sewing's an absolutely important skill. Kitty can't sew. I have to do all the sewing. And suturing is sewing using skin. And there's techniques to it. Now they give you the advice, which is reasonable. Butterfly it. The best way to close a wound is to apply sterile adhesive strips after disinfecting it. Okay. First, line up the edges of the cut. That may not be possible. Cuts are not just necessarily like this, they can be like this. And then starting in the center of the wound, place an adhesive strips end on one side of the cut. As you lay the strips across the wound, push the wound's edges together. Don't do this tightly. Make sure that the inside of the wound can ooze out, and have a dry dressing. As you lay the strips to the wound, push the edges together. Apply these bandages in a crisscross pattern down the length of the wound to keep the sides in contact, and then apply a sterile dress wrap. So they're telling you to place them like this. Just place them like this. This is what all hospitals do. It works for us. I don't know why it wouldn't work for you. Crisscrossing is going to be awkward to take them off. Now when it comes to taking them off, when you remove sutures, stitches, or you remove butterfly, what you want to do is after a week or 2 weeks, when it's time to take them off, you want to remove 1, 3, 5, 7, 8, called removing alternative sutures or alternative butterflies. Butterflies should be classified as a suture. And the reason you do that is because if you take them all off and you put some pressure on the wound might go and open up again. So you do it for 24 to 48 hours, just remove half of it. Slamming it tight together, not a great idea. Here we go. Be super. In a pinch, super glue can hold your skin closed. Yeah, it can. It worked for soldiers in the Vietnam War. Yeah, it did. They also were shoving tampons in themselves, and they had a high death rate. Just make sure the coat is only the outer edges of the cut, not the cut itself. I'm not quite sure what they mean by that. I think they're saying very sensibly, never ever put super glue into the body. Right, so that's my cut. Don't put it inside and stick it like this, but this is my cut, put it here and super glue it there. I'm really not convinced that's a good idea. Along with the polysporin, anything that seals, airtight seals a wound in the field is not going to allow dirt and debris and oozing inside the wound to come out. And what it will do is you'll form an abscess cavity, because even if you've sterilized it with water and hydrogen peroxide and alcohol and brandy, in the wild there's a very good chance that the wound itself will in fact be infected. And infected material always finds its way out, and if you've closed off the actual normal exit, which is the wound, it's going to find its way out elsewhere, and you can get bone infections doing this. You can have all sorts of problems. And again, if you're going to be a couple of hours, couple of days away from first aid, from hospitals, from paramedics, they won't look at you with at all gratitude faced with a super glued wound. They won't be very happy with that. It's a real difficult thing to remove super glue. It causes a lot of skin damage, and I don't think there's any particular place for it. If you need to use super glue, you should have used sutures. Much easier. You're only binding here and here. Super glue binds there, and you have to knife it to get it apart. At this point, I'm just going to steal the Prepared Norseman's little video on bandaging and using a technique that doesn't require tape or safety pins.
Bandaging. Okay, if you need to bandage something and then you need to attach your bandage in the end, your gauze roll, you never just put a wound dressing and then tape it in place. That is not very good. You want to bandage it first. Okay, so here we come to the end. Of course, you can just tuck it. If you have elastic gauze, you can tuck it, which works quite well. If you have non-elastic gauze, okay, or you're using a cravat or something like that, or an older type of gauze bandage, you will not have the elasticity. So what you do, well, you can tape it in place, or you can simply do what they always did before. You cut it down the middle. Okay, so now you have two pieces of gauze, and then you simply tie it off. Okay, a very simple way to attach a gauze bandage, and you don't need tape, you don't need anything, you just need your rolled gauze.
I think he automatically used a reef knot, and reef knots is very important. Reef knot is basically one of the major medical knots, and a reef knot is left over right, right over left, or the reverse. So let's see how we do this, shall we? So first off, you have to get your victim. Then you have your bandage. Left, right. So never ever bandage around the neck. Left, right. Left goes over the right and then under. Right then goes over the left and under. This creates a flat knot called the reef knot. And if you do left over right, or the reverse, you get a granny knot. And granny knots can be uncomfortable. And as you can see, the reef knot is not uncomfortable. And good patients get a bone. And here comes Mr. Beer, because you have to feed both of them. So you'll find that there's lots of different types of bandaging. You can bandage stumps from amputations, you can bandage heads, you can bandage chests. Lots of different ways of doing it. Just please don't ever use super glue and never shove tampons inside the body. Okay? That's it for me. Thanks to Prepared Norseman for allowing me to steal his stuff. He's got a great site. Do check him out and do sub him, and you will find it of value. One of the main things I would like to take away from this is if you're going to bandage stuff, practice. Practice on your dogs, practice on yourself, practice on your partner. It's really useful to actually use bandaging materials and done it. And remember, little bits of tape aren't really going to hold up very well in the wild. They do have a place for some injuries, so you should have some decent tape. Anyway, finishing up, a bunch of slides, show you a few bits and pieces. There are complications of bandaging. You need to assess motor function and pulses by using capillary refill. It gets technical, it gets complicated. But 4 hours or 8 hours training with Red Cross St. John, invaluable. So remember, in SHTF, if you don't prepare, tomorrow will always be worse than today. So let's get prepping. And be careful out there. Step 1, don't have an injury. Toodles.